Thank you, Carly. And now it's on to Professor Kate Drummond, who's from Royal Melbourne Hospital, and she's the first of the awards in the area of brain tumours.
Your Excellency, ladies and gentlemen, I'd sincerely like to thank the Brain Foundation for this grant. I'm particularly pleased to hear that it's supposed to go to young investigators, but I must admit that accolade should probably go to Heidi McAlpine, who's a medical student who's in the audience who wrote most of this. And you'll probably be pleased to hear that you'll understand every single word that I say in my 2 minutes. So if you're diagnosed with a brain tumour in Australia, you'll be treated in a centralised service at a tertiary referral hospital in a multidisciplinary clinic. And that's the right way to be treated for a brain tumour. But that's problematic if you can't drive because you have seizures, or if you're disabled, or if you live in the country, or if you have terrible fatigue. And so we thought that a very useful way to overcome that difficulty with connecting both your doctors and also your fellow patients who you might want to be with for support or to get information, a useful way would be to create an online community for these patients. So we thought that could include online appointments, chat rooms with the brain tumour nurse, educational resources, social network to connect with your other patients. We thought this would be pretty simple. So we looked in the literature, and interestingly we found there wasn't actually that much about online communities for cancer patients. Much of it wasn't really evaluated, and in fact the ones that were evaluated showed that some patients had a worse outcome from participating in these groups. So what the grant from the Brain Foundation will provide is for us to do a very extensive analysis and needs assessment of what patients would actually want in such a platform. It will be both online to gather information internationally and also be able to be done on iPads in the waiting room of the brain tumour clinic at the Royal Melbourne Hospital. And this will hopefully allow us to really link this platform to quality of life outcomes for these patients and build something that would be useful to the patients and hopefully generalisable to lots of other cancer communities. So we thank you very much for the grant and hope that we can come back and ask for more funding when we actually need to build it. Thanks very much.